The approach I like to use is the ABCDE approach, and I think a lot of people like to use this strategy, rightfully so, because it helps make sure that you don't miss anything. So first you're going to start with A, which stands for airway. You're going to trace the trachea down on either side, and then you're going to follow it down the right main bronchus as well as the left main bronchus, and then any distal portions of the airway that you can see. What you're looking for is any signs of foreign body, which could indicate aspiration. You're looking for signs of filling defect or mass effect, and you're also looking for any signs of tracheal deviation. Then you're going to move on to B, which stands for breathing. This is when you're going to take a look at both lungs. What I like to do first is follow each lung border, looking at the lung markings to make sure they go all the way to the chest wall. What I'm looking for here is any signs of pneumothorax or collapsed lung. Sometimes you can see that pleural line in a pneumothorax. Then I like to compare and contrast each lung as a whole. And what I'm looking for is any signs of opacity that could suggest pneumonia, or maybe I'm seeing signs of pleural effusion, or maybe there's even concerns for some kind of mass. Those are just some examples of what you're looking for in the lungs. It's also important to take a look at the lungs below the diaphragm. You can see in this chest x-ray that both the right and left lung are extending below that diaphragm, so it's important to take a look under there. Then you're going to move on to C, which stands for circulation. This is when you're going to take a look at the cardiomediastinal silhouette. So what you're going to do is trace the mediastinum down the right side along the right heart border, and then up the left heart border and up the left mediastinum. One of the things you're looking for is a widened mediastinum. This could suggest something like an aortic dissection. You're also looking to see if any of the heart border is obscured by an opacity that could suggest pneumonia. You're also taking a look at the overall size of the heart and if there's any signs of cardiomegaly. And then take a look at the right and left hilar regions. This is where masses like to hang out, so make sure you observe that. Then you're going to move on to D, which stands for disability. This is when you're going to take a look at the bones for any abnormalities or fractures. I start off by looking at the clavicles, and then I move down to the ribs. I take a look at the posterior aspect of each rib, and I follow it along the lateral border and observe any anterior portions that I can see. Then you're going to move on to the spinal column, taking a look at the vertebral bodies. This is where you can pick up spinal compression fractures or other abnormalities. And then I don't have it highlighted here, but I also take a look at the proximal portion of the humerus that's available on the x-ray, and then I follow that to the glenohumeral joint and then take a look at the scapula. Lastly is E, which stands for everything else, and there's a few things I look for here. First, I look below the diaphragm for any signs of free air. I also take a look at the gastric bubble, and then it's important to take a look at the skin for any signs of subcutaneous emphysema or air. This is also a good time to look for tubes and lines. So is the patient intubated and do they have an endotracheal tube? Maybe they have a central line or NG tube in place, or maybe they have some cardiac wires.